Welcome to the First Nations Health Managers Association's weekly town hall, your resource for the latest COVID-19 related news and information. A town hall for us, by us. Over the next hour, you'll hear from health professionals and community leaders covering a range of health topics that impact Indigenous peoples across Turtle Island. Send us your questions to fnhma@ihtoday.ca. We want to hear from you. And now your host, Marion Crow.
Tanse, and welcome to the First Nations Health Managers Association Town Hall Series. I am so grateful to be broadcasting from the NationTalk office, home of Indigenous Health Today, that's IH Today, and this is the territory of the Mississaugas of the Credit, the Haudenosaunee, the Wendat, the Huron, and we're just delighted to be sharing space in Toronto. My name is Marion Crow. I have the amazing and humbling privilege of serving as the Chief Executive Officer of the First Nations Health Managers Association. I am from Treaty 4 territory, a Pawpaw princess in the house. Very excited to be back. Unfortunately, this is season 5. Town Hall number 51 on COVID-19 information. Not a place FNHMA was hoping to be, but we are grateful to all of our partners who are joining us in getting credible, reliable, and accurate information out to you about COVID-19, Omicron, hospitalization rates. What does this all mean for you, your nation, your loved ones? Well, join us for the next 11 weeks after today. We've got 11 more episodes, 12 in total, where you can find your information. And if you do have a question, if you're wondering about whether it's safe to eat deers anymore because they have COVID now too, well, send us a question to FNHMA@ihtoday.ca. We'll try really hard to get your questions on air. And I do want to say, while you're watching the live edition of the show right now, we are also broadcast at 5 p.m. Eastern Standard, and I believe right across Canada on APTN. Thank you so much, APTN, for having the FNHMA town halls back. So we have a lot to unpack. Doesn't it seem like it's been a hot minute since we were last together? So much has gone down. We got Omicron now. That wasn't around the last time we were broadcasting. I got to tell you, if I sound a little congested, oh, this crow was down. I had bronchitis, and then that followed up with pneumonia. I have not had to be hospitalized. Thank you to my care team for giving me all those good antibiotics and making me rest. Wow, it's just been what a life. And I got to tell you, we are excited about this series of town halls a little bit more than the last ones, just because we're going to try to unpack some more comments, concerns, point of views around how we close the gap on that 10 years of morbidity rates that we live less than the rest of Canada. So you're going to hear from a lot of different speakers in this season of the town halls. And I will tell you now, stay tuned for next week as well, because we're welcoming back Dr. Brenda Rastool, who is going to talk about mental health in COVID. And I know we're coming up to the Bell Let's Talk Day, and that's happening. That's tomorrow, guys. Bell Let's Talk is tomorrow. Oh my goodness, that's good to know. So I do want to share that we're with you in feeling the heaviness that's going on just across the nation's We've got the resources you need, though, and we want to make sure that you tune into Dr. Brenda Ristool next week. We'll be welcoming back Dr. Carol Hopkins, Executive Director of Thunderbird Partnership Foundation as well. So again, if you have a question, send those in to fnhma@ihtoday.ca. Now, we wouldn't be here, like I said, without a number of amazing partners. One of those amazing partners is Indigenous Services Canada. And with that, I want to call into the crow's nest Dr. Tom Wong. Dr. Wong, come on in, give us some epi stats, if you will, and Happy New Year.
Hey, happy to you as well, and to everyone. Bonjour. I just want to acknowledge that I'm on the unceded territory of the Algonquin people. I'm very happy and I'm most honored to be here for the new season's FNHMA Town Hall. And let's look at our slide. Now, when the slide comes on screen, you can see that the chart here depicts the number of newly reported and active COVID cases in First Nations communities over time. The gray line represents the number of active cases, and the bars represent the number of newly reported cases. When looking at both, you can see that both are trending in the right direction. Keeping in mind of lag time, in diagnosis and reporting, and also the need to keep up with vaccine and other public health efforts. And let's look at the next slide. The chart, here depicts the rate per 100,000 of active COVID cases in First Nations communities in green, and in the general Canadian population in red. As we can see, while both may be showing signs of improvement, the rate in First Nations communities is higher than that of Canada's. If we look at the next slide, please. The chart here, shows the tracking of the rate of newly reported COVID deaths in First Nations communities in green, and in the general Canadian population in red. It's a rate per 100,000. And we can see that the gap between First Nations communities and the general Canadian population, is narrowing. Next slide, please. As of January the 18th, over 1 million vaccine doses have been administered in First Nations, Inuit, and territorial communities. And of those, over 85% of individuals aged 12 and up have now received 2 doses. But only 20% of adults have received a booster dose. Over 40% of children aged 5 to 11 have received at least 1 dose. And let's look at the last slide. The information here is available on the Manitoba provincial website. It shows that unvaccinated individuals are at much higher risk of hospitalization, ICU admission, and sadly, death. And those who are not fully vaccinated are 4 times more likely to be hospitalized with COVID when compared to those who are fully vaccinated, and 21 times more likely to be admitted to ICU, and 17 times more likely to die with COVID. And let's turn over, to our discussions regarding what is so important about a booster dose. Perhaps we can turn the slides off now. And taking a booster dose when eligible, vaccines are effective against serious COVID outcomes, including against the Omicron variant that Marian talked about, and serious outcomes such as hospitalization, ICU admissions, and fatalities. And everyone has a role to play in protecting elders, families, and communities from COVID. It is never too late to take action. Avoiding large gatherings, physical distancing, hand hygiene, and following regional travel and gathering restrictions are essential to reducing transmission and minimizing the risk of severe COVID as much as possible. In addition to getting optimally vaccinated, we can reduce our risk by properly wearing a well-fitted and well-constructed mask in public or private spaces with people outside our immediate household. Regional and local epidemiology should be taken into consideration, in addition to provincial, territorial, and local public health guidelines to inform a tailored approach, a tailored strategy at the community level. I would like to acknowledge that First Nations, Inuit, and Métis partners and leaders have demonstrated great leadership over the course of this pandemic to protect Indigenous peoples. The pandemic has restricted the ability to travel and gather, which is a cornerstone to many Indigenous traditions and culture. Mental health issues associated with intergenerational trauma, including colonization, residential schools, day schools, 60 Scoop, and missing and murdered Indigenous women have been exacerbated as a result of the pandemic. Additional mental health resources, such as the 24/7 Hopeful Wellness Helpline, are available for Indigenous peoples across Canada. It is important to be able to lean on one another during these difficult times in ways that protect each other and overcome Omicron. Miigwech, Nakumek, merci, thank you, and merci. With that, I'll turn over back to Marian.
Dr. Wong, thank you so much for that information. We really appreciate getting that directly from you. And don't you worry, Dr. Wong, don't go anywhere. There are questions for you in the inbox. And don't forget, the inbox address is fnhma@ihtoday.ca. Now let's take a couple of moments for a quick break.
I used to feel such shame. It was hard being surrounded by women who trauma and abuse left cruel streaks, violent behaviors, and disconnected ways of loving. And now I'm freeing myself from that shame. This is where our societies, our circles, our connection to the land comes in. Learn to be kind to yourself and to others.
There's lots of bullying at the school that I come from. I ended up in a neck brace. I had a concussion. I got kneed in the back of the head. Sometimes things can get really bad and you think, oh, like there's no point of like being here. The support from people around you has a lot to do with the anxiety and depression. Because I'm different, a lot of people didn't understand. Through acceptance, we find belonging.
Welcome back from that break, and perfect timing now to bring in another wonderful friend of the FNHMA Town Halls, and that is Leila Gillis. Happy New Year, Leila. Come on into the crow's nest.
Well, thank you very much, Marian, and happy 2022, I guess, to you and everyone watching or listening to the Town Hall today. I don't think, as you said, Marian, any of us thought we would have a 2022 series of the Town Hall. But alas, here we are. I think the last time I joined the Town Hall on behalf of Indigenous Services Canada was back in June of 2021. And today's my first Town Hall, having a partner from Indigenous Services Canada. And I'm so thrilled and happy to be here joining my respected colleague, Dr. Tom Wong. who I've been lucky to have had the opportunity to work with since the declaration of the worldwide pandemic nearly 2 years ago. In fact, it was, I think, at the end of January 2020 when the World Health Organization first declared the outbreak as a public health emergency of international concern, which then led to the official declaration of the pandemic in March of 2020. But I do want to acknowledge first that today I am joining you from my home in Ottawa, which is located in its beautiful, cold winter splendor on traditional and unceded territory of the Algonquin and Anishinaabe Nation. And I want to acknowledge the traditional stewards of the lands upon which all of those participating in the town hall gather from coast to coast to coast. My role at Indigenous Services Canada is national in scope as the Senior Director of Primary Care Services and also as the Deputy Chief Nursing Officer. And I've been a registered nurse for over 30 years. As I was preparing for today, I reflected back on where we've come from. You know, at the June 2021 town hall, I shared that there were just over 30,000 total cases of COVID since the beginning of the pandemic. And this week, 7 months later, the case numbers have more than doubled to over 66,000 total cases. But Dr. Wong has shared so much already on the public health epidemiology information and has discussed how critically important vaccination is to prevention of COVID. On a personal note, as soon as I was eligible, I received my third vaccine dose and was so encouraged when my brothers and sisters and my 92-year-old mom back in Newfoundland let me know that they got their third dose as well. So I'll focus a bit more today on the primary care side of the COVID response. And since I was last here, there have been further progress on the development, approvals, and distribution of COVID-19 treatments. And Indigenous Services has continued to work with Health Canada, the Public Health Agency of Canada, and the provinces and territories in securing allocations of treatments specifically for adults with mild to moderate COVID-19 symptoms who are at high risk of progressing to serious disease and/or hospitalization. Our teams have worked to pre-position monoclonal antibody medications to most of the remote and isolated communities. And they all have this medication called sotrovimab pre-positioned should it be required. And when an individual is assessed as a candidate to receive this medication by their healthcare professional, the treatment is delivered through intravenous or IV infusion by a qualified health professional. Also, just last week, we received the exciting news that a new treatment, which is in pill form, or what we may hear referred to as oral antiviral medication by the name of Paxlovid, has now been approved in this country. And the Government of Canada has been working with federal, provincial, and territorial partners to allocate the limited first supply equitably across the jurisdictions. These partners have also discussed the distribution process and the shipment of the medications. To determine how many of the first limited treatments were to be sent where, some interim criteria were considered in determining the current allocation, which is to remote and isolated First Nation communities. And some allocations have gone also to provinces and territories as well. Indigenous Services Canada will continue to work with partners in determining how best to manage further allocations as the available supply in Canada increases over the coming months. And this is good news indeed. However, no treatment, including those monoclonal antibodies, so sotrovimab, the antivirals like Paxlovid, are a substitute for vaccination. They are additional tools to help in our response to reduce the impacts of COVID. Together with public health measures as described by Dr. Wong, vaccination remains the most important tool in preventing severe disease for COVID-19 infection. I want to give a shout out to our pharmacy and nursing teams at Indigenous Services Canada, who've worked hard to assure that the health professionals on the ground in the First Nation communities who have these treatments have all of the information and education they need to administer the right medication to those who most need them in the safest way possible. And speaking of health professionals, I really want to acknowledge how dedicated they all have been. But boy, are they tired. As our community leadership and managers and all of the workforces that are supporting communities to keep critical operations going. And for that, I thank all of you. I know many communities have been so appreciative of services provided by their health teams. And those teams in particular have undergone more COVID screening, varieties of tests administered, they've isolated, sometimes from their families, all to try their very best to protect the clients they serve. We've all heard about the shortages and strain that has been put on the healthcare system. Some early data is signaling that 1/3 of our existing nursing workforce are thinking about leaving their current role or the profession altogether. During the pandemic, depression and anxiety has been climbing generally in our populations. And among nurses, it has increased over 40%. And I want to remind those frontline healthcare workers to double down on self-care. Take care of yourselves. Remember to rest, eat well, drink lots of water. And it's as important as ever to just support each other, check in on each other, be kind to each other. If a community or individual is wondering how they might recognize an exceptional nurse they know, this year is the 20th anniversary of the Indigenous Services Canada, First Nations and Inuit Health Branch Nursing Awards of Excellence. Nurses who practice in frontline roles directly for First Nations or in Inuit communities or for Indigenous Services Canada are eligible to be nominated. And nominations are currently open for the next 4 weeks. There will be a virtual celebration where there will be a recognition of all nurses for their great contribution to the COVID response and maintaining health services in First Nations and Inuit communities. But 3 distinct nurses will receive an award at the ceremony during National Nurses Week this coming May. For nominations, go to the Indigenous Services Canada website at www.sac-isc.gc.ca. And thank you, Marion, and all the team for all of your great work in bringing back this important cross-country forum for information sharing and discussion, and for inviting me and Indigenous Services Canada to join you this week. So happy to be here. So now I'll turn it back to the crow's nest and Marion in Toronto.
Leila, thank you so much. When I think about the years of service that you have committed to keeping this country safe, I just personally want to thank you. It's appreciated. You are a town hall favorite. It's that East Coast love that just pours through. And I love the pin as well. So I'm just grateful. Who would have ever thought we would be? And I thought, well, it's 2020. And then we were saying, well, it's 2021, just write it off. And now here we are, 2022. And when you were talking, Leila, about, March 2020, wow, who would have thought we'd be passing laws to not intimidate our health workers? This is where we are, folks, 2022. But show your healthcare worker providers supports, love, encouragement. They are exhausted like everybody else in fighting this global pandemic. Another favorite, one of those frontline workers are our health managers who are trying to manage and mitigate all of the staffing crises because people are exhausted or they too are sick. I saw a meme recently of somebody a person sitting in a hospital bed saying, "Nurse, And in the next bed, the nurse says, yes. So we know that community spread is rapid fire. So I want to say, a health director, we've lined one up. Mr. James Bone, certified First Nation health manager, my boss as well, just saying. So be kind to him, audience, listeners, viewers. We've got people tuning in on the radio stations, watching Facebook live feeds, and also picking us up on APTN 5 o'clock on Saturdays. Let's show some love to Mr. James Bone from Kesey in a Treaty 2 territory in Manitoba. James, come on into the crow's nest. Hi, James.
Hi, Marion. Thanks for the beautiful welcome. Glad to be part of coming into the crow's nest today. I too have been a big fan of the town hall meetings whenever I had time to sit and watch, but I was glad that there's reruns and you could watch them late at night if you want. And I did that several times. But anyway, I'm glad to be here today, coming to you from the Easygoing in Treaty 2 First Nation Health and Wellness Center. Glad to share my story, my perspective from the community, from the front lines. Where to start? You know, I agree with Dr. Wong. Those vaccinations and those booster shots are key, and that's what's working in the communities. I'm just going to kind of just give you a quick update on where we sit today in our community. Today we've, I guess this round, we've had 20 cases this round for I guess this outbreak. And we're down to 12 recovered now, so we're going the other way now, which is good. We have eligible male population that are vaccinated 18 and older, that's 85%. The female population 18 and over is at 92.5%. Come on, guys, we're behind. The eligible male population from 5 to 17 is at 56. The female population ages 5 to 17 is 72%. So the ladies are leading ahead here in Kesey, guys. So I hope that everybody in Manitoba, for that matter, let's bring up those vaccination rates for percentage rates for the guys. I think we need to move up on that. So that's where we're at. We've had we haven't had any hospitalizations this round, although some had to attend to the for you know, brief medical assistance and medical help and advice, but they were allowed to come home, so which is a good thing. So no hospitalizations this round. I guess there's different levels of severity that this virus takes, hits people when in terms of their and that vaccination status makes a big difference. So we have from 0 symptoms, people feeling well, but they've tested positive, but and not even any signs, to some that, well, like I said, some had to go to the hospital, but they didn't get hospitalized. So that's the range of the I guess the severity of it, of the virus and how it causes us to get ill. I guess, but like I said, people with the booster shot have fared well, you know, so we're constantly encouraging. In fact, we had a clinic happening today, and we have one happening Thursday, and those are booster shots. So we've been pushing for that all along, and making sure that we try and get our numbers up there. So, which is a good thing, keeping those numbers up, and that's what's going to make it a lot easier for the frontline workers here in the community. I think I'll zero in on that for a bit, on the frontline workers. We've had to make some workplace adjustments. so that we could give some of our employees, the frontline workers, the healthcare aides, the nurses, etc., a break. We've been going at it since Christmas time. We started here right after the New Year break, and had to come back to work. So we had a little Christmas of a break, but anyway, that's okay. The work is more important right now. So for the adjustments, I had to make some, I had to look for different experienced staff in different areas. And I'm very fortunate that we've had a fair amount of healthcare aides that assist the Jordan's Principal program. So we're drawing on those people to come in and free up my regular healthcare aides. So we've made those adjustments. I had my key team that had been leading the way since Christmas time, since Christmas break, are off on a break. They started on, well, of course, the weekend, and 2 days in, Monday and Tuesday. So I gave them 4 days that, a nice little break for them. And I haven't heard from them, so they're really enjoying the break. So, and we told them, don't be calling here and worrying about anything here. We'll take care of things. So, and I've had that workplace redeployment of staff. So those are the ones that are picking up the work while my players are away on a break. So that time off is going to be key. We have to make time for our frontline workers. Otherwise, we could end up losing them or quitting or getting sick. And very fortunate that the frontline workers, I'm calling them, they've held on. They've held their own right now, and we're very fortunate for that because they're in a very high risk zone. Testing and vaccinating, doing all of that work. It's very high risk for them, and along with that comes the stress. So it's important that we make some time for our employees, as I did, for their mental health supports. And I've provided personally with very fortunate that I have a little bit of experience that I could do that and a little bit of training that I could do that. So I've been able to debrief some of my employees before they went on their break so that they're not leaving, they're not taking home and any of that additional workload or that thought, so you got to train them to leave their stuff at work, leave their stuff someplace else so it doesn't follow them home. And when they left here, they were feeling great. They were smiling, and everything's left with you, James. They said, and away they went. And I guess it'll be me doing the next debriefing on myself here at the end of the day. But I've been doing fine myself, and I have. We all need to have plans in place for ourselves, for our own health and well-being, our own mental health, and our own self-care. So we need to have little plans in place for each other, for our own, health and wellness. No matter how, whether you're a doctor or whether you're a, frontline worker, whatever your capacity, we all need that support from time to time. We all need to do a little vent, is what I call it, once in a while. And once you've done that, you've got it off your chest and you can move on. So mental health is a key thing here for our employees, and not only the employees, it's for the community as a whole. We've faced several, a lot of trauma over the last while. The Dr. Wong mentioned briefly about that. The graves. So we had to deal with the unmarked stuff, unmarked graves. We had to deal with that in a community level too. So we had to work on that end, plus the COVID front. So we've got all types of mental health issues to be working on, when we can get around to it, when we can get rid of this COVID and get over this COVID, so we can start our healing again and start living well in the community and living I don't know what the normal is going to look like these days, but I don't know if it's going to change or go back to the same way. I don't think so. Another key area I kind of wanted to touch on is our traditional healers. And I'm sure we have traditional healers all over the place in our communities. We have a lot of that happening in our community. We have our medicine people, our medicine ladies, and they've been keeping our community equipped fully with the pandemic flu medicines, and we have those here quite a bit. People are picking them up here at the health center. They run a clinic. They don't have the clinic in the health center. They run it in a private home, just for safety reasons, so that they don't get in contact. And then they drop it off here, and then we have a system for them to pick it up at the door. So it works well. So that medicine really comes in handy, and it's working when people are using it. I've tried it, I've used it, and it's kept me in good health. It's a proactive measure. In my case, I've been very fortunate, touch wood. If I find some wood in my office here, maybe this part is the wood part, but anyway, to stay safe, for myself. But I'm doing a lot of self-care like that in that regard, taking good care of my health. So drinking different kinds of medicines and anything that helps, James is taking it. So, but funding supports, we have all kinds of funding supports from our partners, ISK and First Nation Inuit Health. So I can't forget them, to mention them, because that's how we're getting through this COVID also, by the dollars they're sending us and what we're able to do with it, and buy supplies, buy safety, masks, all the stuff that we're required to do. So that's one good thing with all that funding. We've also had the Red Cross assisting us along the way, right from the beginning of this. They've provided all kinds of stuff for our AIA sites in our communities. We've taken advantage of that. We have that stuff here too. We just, unfortunately, we haven't set up our AIA site. We've had difficulty in doing that due to it's not quite finished, the facility we're using. So we had some issues there, but anyway, it's workable, it's resolvable. So lots of good stuff happening. I guess I made several notes all over the place here. I'm trying not to look obvious that I'm reading. I guess I gotta just keep doing this. So I guess when we listen to the stats, all of a sudden I find out from the stats today, I got 10 years less to live. But yeah, I'm doing a good job right now. So I think I'll probably try and live a longer than that. I'll take those 10 years back is my goal. And take care of myself, take care of all my people around me. The masks, we need to stick with the masks, the vaccinations, all the booster shots. We got to stick with those to keep us well and healthy. Follow the restrictions that are laid out before us. We follow the provincial guidelines, so we're using those as our guide, and we develop our own rate on the ground here if we need to. So we follow that here in the community. I just like to encourage everybody to stick to your bubbles. Less contacts. The less contacts you have, the better off you're going to be. Keeping your household safe. So that's key. Follow those protocols to the T. Stay home whenever possible. Don't go roaming around the community if you don't have to. There's also the local co-op stores in our area. If you have a grocery list, you can phone your grocery list in, and then they'll put your order through. All you have to do is go there and pick it up and pay for it. So that's one good thing about that. So I think I probably said lots here enough. I think I've covered it all. So I'll stop there for now, Marion. Thank you. Miigwech.
James. Thank you, James. And for our viewers, our listeners, and our watchers, can you remind us again where you're situated? How far is your nearest hospital where KC members would go if they were admitted? What range are people driving? I know that, but let's share it with our viewers.
Yes. We're about, the Brandon Hospital is an hour and 15. Minnedosa is 45 minutes. So those are our nearest hospitals, the Minnedosa and the Brandon Hospital, but they're still a distance away. So, yes.
And James, I do want to congratulate you as well in terms of being the first person that I know who had their booster shot. When did you get that booster, James? And how did you get them there so quickly? I was so pleasantly surprised to hear that. Tell me about that process, James.
Yes, I believe I may have caused a little bit of shockwave at FNHMA by having my shot a little earlier than it was supposed to, but I did it anyway. And it was available here, and I hope I didn't cost my nurse any problems, but she knew. She said, "Hey, James, did you tell somebody?" Because we weren't supposed to, but I did. I tried not to. I couldn't remember where I said I did, but I guess I did. But anyway,
now I'm just blabbing it all over the national airwaves.
yes, but that's how dedicated I was and why I wanted to get that shot. I did not want to. I wanted that booster shot because I didn't want to take it home to my kids and grandkids because they weren't able to. My grandkids, that is, they weren't able to take the vaccination yet. So I was concerned about that. So I jumped in front and put my nurse in that situation. And I think maybe FNHMA gave her a little call or something. With anyway, I apologize to FNHMA, I guess, but I'm healthy, I'm safe, and I'm going to be, I won't be so hard on you next time when I have to speak with you, FNHMA. Dr. Wong, Leanne, however you, sorry.
Leila will be just grateful that you got that dose, James. We're not creating a scandal. We're just so happy that you're protecting yourself. And at that time, the little ones weren't able to get vaccinated yet. So I'm so glad that you did your part, James.
Yes, that was the main reason, because I didn't want to take it home to my grandkids or anybody's grandchild for that matter. We're in touch with everybody here at the health centers.
Well, James, don't go away because we will have some questions for you. And another reminder for those that do have questions, you can send those anytime. It doesn't have to be right now. Our partners at Indigenous Services Canada have agreed to come back every week and give us a state of the nations in terms of epi-stats around what's happening with the latest news. So you can send a question anytime, and you can send it to FNHMA at ihtoday.ca. And if it doesn't get aired on this episode, we will make sure to bring it forward to a future episode. So don't you worry, get those questions in. And before we go to that inbox, we're going to take a short break and we'll be right back.
There's a harsh world out there telling us who to be, what to be, telling us that we don't deserve love and respect unless we're something we're not. After I got assaulted, after I went through the trauma, I went back home and I connected with my roots and I connected with my family. Their wisdom helped me a lot. My family, my kinship, they rejuvenate my soul. They remind me that I deserve love. Our culture teaches us something powerful: compassion.
There's no such thing as an old addict. You either get clean or you die. I knew I needed to stop for my kids and my grandkids. There is hope and there is people that do care and they do love you. I learned that our culture teaches something very powerful: compassion. Through acts of kindness and compassion, we find meaning in ourselves. I found connection. When we're connected, we're never alone.
And thank you so much for that information. Let's dive into the inbox now because there are questions. Dr. Wong, come on back into the crow's nest if you wouldn't mind. And for any of our other panelists, if you want to share your experiences or have something to contribute to the questions, just click the unmute and we'll bring you back in. So I think, Dr. Wong, we're going to talk about deer. In the middle of all this, we're going to ask a question. We have heard, and it could just be through Moccasin Telegraph, fake news, Google, Facebook. This is why people come here, to get reliable, credible, accurate information. So we hear that the animals have COVID. Are we still okay to hunt and eat deer? What does that look like for us, Dr. Wong?
Yeah, thank you so much, for bringing this question up. It is so important, to know that, the virus, is spread, by respiratory means, so like coughing, etc. So, it's not spread by eating, the deer meat. And definitely, strongly encouraged to continue, the traditional food. It's important to protect ourselves. Traditional food, is so important, for all of us. So don't stay away from traditional food. Don't stay away from hunting. During hunting, it is important, that there's physical distancing and infection control, et cetera, et cetera. All of those things are important, but, do not stay away from eating traditional food.
Thank you so much for clarifying that, Dr. Wong. And stay with me here, Dr. Wong. I'll throw you another question, then I'll move over to Leila and to James. Or again, feel free to chime in if you want to contribute. Dr. Wong, there is a question with respect to capturing the true number of active cases. Can you speak to any information on how First Nations are being represented in hospitals and ICUs? Do we know that kind of information yet? I know you've talked about our immunization and comparing our COVID cases to mainstream Canada, but what do those hospitalizations look like?
Yeah, I think that one of the things that's so important is to actually know that these days now with Omicron affecting all over Canada, including both Indigenous population and peoples, as well as the general Canadian population. And you've heard, that some, people are no longer doing the tests because, there's just too many, people are sick in the general Canadian population. Also, some people are doing the test at home. So when they do that, some of those results may not actually get into the provincial statistics or the database. So what that means is that both, at the general Canadian population, as well as in the First Nations and Inuit and Métis populations, this is the numbers are underestimate of, the actual number of people with infection. And one of the things that it's so important, to see, as you saw one of the slides, was that with the adequate amount of vaccination, you see, that would actually prevent, hospitalization, ICU admissions, and fatalities. As a result of that, depends on which part of the country, you are in. In some parts of the country, you are seeing very few hospitalized cases. In other parts of the country, you're seeing more hospitalized cases. Why? It's because, of the immunization level, in particular, the second dose and the third dose. And I'm so happy, that James, was talking about, his own story about getting the booster shot. It's so important because with the booster shot, you even elevate your level of protection against hospitalization, against ICU admission, more than, the second shot, and definitely more than the first shot against, this Omicron. And with that, maybe I'll turn over to James to see, if he has any additional comments, to make and additional stories to share. I'm so happy to actually be here to be listening to James's, story about his booster shot.
Thank you, Dr. Wong. Yes, the booster shot. I don't even know if I don't think I've even gotten a cold. So I don't know if that has a play in it. I haven't had a cold since last July. So it's been quite a while, and that makes it a bit different. I guess the masks and everything else, but I'm sure the COVID, the booster shot may play a little role in some of that too. But also, I know we have stories coming out today in our community where the people with the booster, they're sharing on Facebook, by the way, their stories also. They've had booster shots, no symptoms, zero symptoms, even though they've tested positive. So that's a real positive message to be pushing out there. Even if those that got COVID, they tested positive for COVID, but they've had the booster shot. They had 1, 2, and 3, I guess is how we could call it. So it really makes a big difference from zero symptoms, which is, wonderful to hear, and so that's where things are at, Dr. Wong. It sure does its job. That booster sure does its job. So we need to keep saying, everybody out there, get the booster shots, get that booster shot here in Manitoba, across the country, in Kisii, in every First Nation community. Thank you.
You couldn't have said that better, James. Thank you so much. And it's like you guys were peeking into the inbox and saw some questions in advance, because people were asking about, if Omicron is so contagious, I'm going to get COVID, and that's my strategy to keeping safe. So I'm glad to hear you both say, get the boosters. It really makes a huge impact on our hospitalization rates, those who are immunocompromised, and those who are not able to get a booster. Now, Dr. Wong, Leila, whoever wants to take this question, the question is, I didn't break up. I really did pause that long. Sorry for that long pause. But people are wondering, are we going to have to keep getting more booster shots? How many more? And I know that this is evolving. Obviously, the science is catching up to the various variants. And now that we've got a pill approved in the antiviral toolkit, what do you say to the folks who are saying, like, if I've already had COVID, I don't need a booster, right? Wrong. What do you guys say to that?
Yeah, thank you, Marian. Maybe I'll start first and turn over, to Leila. With the natural infection or with an infection with COVID, one does actually get some protection, from infection. But just like the vaccines, the protection is only, for a period of time. And then, you have waning immunity. And so therefore, even when one gets a natural infection from the virus, it is so important, to get your doses. Think of, them as you need additional protection around you so that, you had the one infection. It's important to get your doses of vaccine also, because those doses of vaccine will have added protection, against the virus. It is so true that, with whether it's with natural infection or, with vaccine, with time, the body, the protection does wane or does go down. At this point, the scientists around the world are still studying, is it necessary, to actually get a fourth dose? And if so, when? And you saw that, some of the studies that's coming out of Israel, for example, looking at, having a fourth dose, is that helpful? And the preliminary information is, maybe not so much in protecting against infection. Now, however, these are early days. And I think that the important thing, is for now, is get your first dose, your second dose, and then get your booster dose when you are eligible, as soon as you are eligible, and then wait for the scientists globally, to actually look at all of the new studies that's going to come, especially against the different variants. Because right now we are fighting the variant Omicron by and large. However, in the future there may be another variant, coming our way. That is so important to keep in mind. So with that, I'm going to actually turn over to Leila.
Oh, thanks, Dr. Wong. I mean, I defer to you, but for sure, in regards to people who've had 2 doses of vaccine, who, are exposed and get infected with the Omicron variant, once they're feeling well, after, if they're having symptoms, it's definitely recommended to still, get that booster dose, because it does provide even more response in regards to protection for hospitalization and for severe disease. So I'll just add that to Dr. Wong's great summary.
Thank you. And James, this has been, as Leila mentioned earlier, such a challenging time for the front lines, for all of the workers. In like 30 seconds or less, James, what would you close this out with that would offer hope?
Stay safe. Rely on traditional knowledge, traditional prayer, whether you're traditional or non-traditional, prayer seems to help, it gives us hope, faith gives us hope. Yes, a lot of prayer and ceremony, we can rely on our ceremonies to do a lot of that. Throughout the winter, a lot of ceremonies do happen, so rely on those. Go back to the traditional medicines. Fourth facts, give us a break. Yes, we might need that, but if there's going to be another, we don't know what's going to happen yet. So at least right now we can have a short break if this happens. We all need a break. Every healthcare worker in the country, everybody that's fighting COVID, eventually going to need a break. So hopefully we get a little reprieve in between sometime before something else pops up.
Well said, James. Thank you so much. And thank you to everyone who is partnered with FNHMA, IH Today, NationTalk, including Micmac Maliseed News, The Wolf, Nation News, FNHMA, Element FM, Anishinaabeg Nation, Wawate News, and Element FM. See you Saturday, 5 p.m. Hi.